I'll take you to the Central Region. The Ghana Medical Association there says delays in the release of test sample results of health staff or to health staff is the cause for the rising cases of infection among health officials in the Central Region. According to the Central Regional Chairman of the GMA, Dr. Justice Arthur, the situation has been worsened by patients' failure to disclose accurate information to doctors.
Site in Cape Coast. So the sample goes to Accra, Kumasi, or other testing sites. Some you get the result within 1 week, others 2-3 weeks, results are not in. If you test positive, you can do contact tracing. Staff who have come into contact with patients, you ask them to undergo quarantine, then you can test them. But if the result delay, those people also might, if it's positive, will get the disease, but they are still working. So I'm sure we are now overwhelmed because our numbers have gone down. Resources to work with. Now you have to be purchasing this soap, hand sanitizer, tissue, and other things, which usually we're not using that much, gloves and other PPEs. So money has to go to the other, into COVID. So everything has changed. Not forgetting the diseases, malaria and the diarrhea, and the respiratory infections are still there. So with health workers getting, people from the community as they come in might not give you the correct history. It's when they are already in, you have admitted before you get to know the correct history. The health worker is supposed to be provided with appropriate PPE, and it should be available always. So depending on where you are working, you are advised to probably use only the face masks, goggles, or you use a coverall. Some have been provided, but it's always not enough. This case of cloth masks that we are using, though FDA says that is comparable to the N95, which is the standard, other health workers do not believe that. So its use, though we are using it, but others find it difficult to use, especially if you are in a treatment center where there are patients. You can't be using cloth masks or inappropriate PPE. So the logistics to work with has been coming, but not enough. We use what we get from the region, but the facility's ability to buy some, we are constrained by non-payment of national health insurance money due us. Yes, they have paid some, but it takes a long time before it comes. So before the money comes, your IGF is not enough. So you run short of some items which could put staff or our patients in danger. So all these factors, then it could be negligence on the part of the health worker, because at times you use this mask, you can't continually use it. So you might decide you want to breathe, you lower it. Surfaces that we touch. Unfortunately, somebody says you touch your face about 15 times in an hour. So definitely you have to rub your eyes or scratch your face. And if your hand is contaminated, you could be. So probably neglecting some small things. Usually as you work, you have to be washing your hands using sanitizer, but you might miss something and that could endanger you. So these things probably might have caused health workers to get it. But there's a saying in Fanti or Akan. Definitely, we are working with patients, people come in, will be exposed one way or the other. I'm sure you can take all the necessary precautions, but you may have it. But fortunately, most of the cases have been mild.
Let's head to the Central Region. Richard Kojo Nyako is our correspondent there. He will tell us the situation there. Hello, Richard. I'm assuming that you do hear me. Let's start with an update on the health workers who had to go into isolation because they were exposed. What's the latest?
Well, so at the moment, about 150 health workers, including doctors, have tested positive for the virus. And you know that the Central Region has crossed the 600 figure in terms of the national update that have been given. So a lot of them have also gone into isolation. So as you heard, the regional chair of the Ghana Medical Association, Dr. Justice Atta, intimating that it's led to a situation that, I mean, a very difficult situation for them because a lot of them would have to work, do more than expected. Normally they would have done. And so it made the situation very difficult. Coupled with the lack of testing center in the Central Region, the Central Region has a lot of treatment centers. We have that of the Trauma and Specialist Hospital. We have the Cape Coast Metro Hospital. We have the Cape Coast Teaching Hospital. These are all treatment centers, but they are talking about testing centers. And that's why they will take the samples of someone in the region, and it takes about 20 days. Sometimes it takes more than 20 days. And he explained that that has accounted for a lot of infections among the house staff, because when your test sample is taken, you do not know where your status, whether you are positive or negative. And so if it takes that long, then it becomes problematic. They might be infecting themselves, they might be infecting their families. When they go back home, they might be